How to identify symptoms of social anxiety disorder in children. Social anxiety disorder, also called social phobia, is often mistaken for simple shyness or other disorders in children. Social anxiety disorder is more than simple shyness, it can be disabling. Intense fear and avoidance of social situations and performance activities is the hallmark, and can be severe enough to significantly interfere with your child's daily routine, school, and relationships. Social anxiety disorder occurs often in teens and adults, but it is common that it shows up in children and may go undiagnosed for years. Recognizing the physical, emotional, and behavioral symptoms of this disorder will make it easier for you to help your child early. Method 1: Recognizing behavioral symptoms. 1. Speak with your child's teachers. Children with social anxiety disorder often struggle to participate in class and interact with peers. Since you can't observe how your kids act at school, discussing your child's in-school behaviors with their teachers can be valuable. Social anxiety may be a problem for your child if they do not participate in class by asking or answering questions, reading aloud, or writing on the board. Reading or being called on causes them distress, which may look like blushing, crying, tantrums, refusal, or poor performance despite ability. They often sit alone in the cafeteria or library, and stay removed from peers at school. 2. Listen to your child's underlying messages. Children with social phobia are generally exceedingly fearful of criticism and overly concerned with humiliation or embarrassment. Young children are probably unable to recognize and tell you that they have fearful thoughts, but consider statements like these as possible indications of social anxiety. What if I say the wrong thing? I'm going to say something stupid. They won't like me. I'm an idiot. People say I'm anxious. 3. Observe how your child socially engages. Children of all ages are constantly maturing socially. Fear of or refusal to socialize could indicate that your child is anxious about being around others, speaking with others, or being in a public environment. Invite friends over or take your child to play dates, and watch how they engage when around others. Social anxiety in children may appear as any of the following: refusing to go on a play date if a parent is not present, or asking a parent to be always available. Being extremely clingy to you physically when around others. Refusing to initiate conversations, invite friends to hang out, or call, text or email with others in their age group. Older children may stay home on weekends instead of hanging out with friends. 4. Notice how your child speaks with others. Your child may feel so anxious speaking to others that they are unable to carry on a conversation. When they do, they may speak very softly or mumble. Frequently, socially anxious children avoid eye contact with adults or peers. Behaviors can occur with people your child knows or with strangers. 5. Watch for performance stress. Performance type of social anxiety disorder is intense fear and anxiety about speaking or performing in public. This can occur at school, such as presenting a report to the class, during a music recital, or even playing a sport. Sometimes children may be so anxious about performing that even eating in front of other people or ordering food at a restaurant causes stress. Using a public bathroom can incite anxiety for some children. 6. Evaluate your child's sick days. Social anxiety in children commonly presents as school refusal, your child being so anxious about attending school that they seek excuses to stay home. This can present as faked illness, or even physical symptoms of anxiety masquerading as illness. 7. Notice if your child will try new activities. Starting new activities can be one of the most challenging events for a socially anxious child, where they would be forced to encounter a new peer group and partake in a skill with which they are not comfortable. Refusing to try new activities is frequently seen with socially anxious children. 8. Look for meaning in tantrums. For young children who are unable to verbally express their feelings, tantrums may be the most frequent expression of anxiety. A child's fear might present as severe, prolonged crying or tantrums. If this is a common occurrence in your home, look especially hard for other signs of social anxiety disorder. Tantrums related to anxiety can be misunderstood as oppositional or being a difficult child. Method 2: Evaluating physical symptoms. 1. Watch for objective signs of anxiety. Anxiety is a serious disorder that very often causes physical body symptoms. In the face of performance or social interaction, your child may demonstrate physical manifestations of their fear. They may become physically immobilized, literally paralyzed with fear, have trouble catching their breath, and have a racing heartbeat. 2. Notice if upset stomachs are caused by anxiety. It is not uncommon for a child to become so anxious that they have diarrhea, nausea, or even vomit. If your child has frequent upset stomachs, start a log of when these bouts occur. If it's often in response to doing or thinking about a social or performance activity, that's a tip-off to social anxiety disorder. 3. Ask your child about their subjective experience. Dizziness, lightheadedness, confusion, feeling outside of the body, and muscle tension are other common physical symptoms of anxiety. These may be difficult for a child to recognize. Ask your child questions to elicit information about their subjective experience with anxiety. Try questions like, do you feel like the room is spinning or like you might fall down? Do you feel achy or sore all over? Where are we right now? What day of the week is it? Inability to answer simple questions can indicate confusion or panic. 4. Watch your child's face while they interact with others. If he or she often blushes, sweats, or shakes in social environments, it may indicate social anxiety. Method 3. Understanding the disorder. 1. Assess whether your child has risk factors. Anybody can develop social anxiety disorder, but certain factors can contribute to the likelihood of it occurring early in children. It can develop suddenly after a stressful or embarrassing experience, or slowly over time. Evaluate whether any of these risk factors pertain to your anxious child. Your child is more likely to develop social anxiety disorder if their parent or any siblings have the condition. Trauma such as abuse, family discord like divorce or death of a loved one, or experiences with teasing, bullying, or rejection can increase risk. Social anxiety disorder is more than simple shyness, but children who are shy, timid, or withdrawn in general may be at greater risk. Starting a new activity or being put in the spotlight for the first time can trigger symptoms of social anxiety that were previously not present. Stuttering, obesity, disabilities, tics, or other disorders may increase self-consciousness and contribute to social anxiety. 2. Review the criteria for diagnosis. 3 major criteria are required for a diagnosis of social anxiety disorder. Keep these in mind to help differentiate the disorder from a simple shy phase, and from other disorders. These are the specific criteria determined by doctors. The fear or anxiety must be out of proportion to the actual situation. It's normal for a child to be nervous about performing in a violin recital or meeting new classmates, but if they are so nervous that they vomit or have an extreme emotional response, it's more than simple shyness. The severity may be in frequency or duration, more extreme, or lasting longer than is typical. These symptoms must persist for 6 months or longer. Otherwise, it may be a shyness phase. Symptoms must cause significant distress or interference with your child's ordinary routine in daily activities or school, such as impairing your child's school performance and attendance, and ability to socialize and develop relationships. 3. Think phase versus disorder. The difference between a phase and an anxiety disorder is that a phase is short-lived and generally harmless. Anxiety disorders often become chronic and cause interference with daily functioning. Unlike a temporary phase like what would occur if your child has nightmares for 2 months about a monster under the bed, being a comforting presence is not enough to help your child deal with an anxiety disorder. 4. Look for reasons for the anxiety. Your child's anxiety about social interaction or performing can occur far in advance of the actual event. This can make it difficult to associate your child's symptoms with the correlated event. Be aware that they may worry about what's coming for up to weeks or months and may imagine worst-case scenarios, and have symptoms during that time. 5. Treat social anxiety like a true disorder. Social anxiety can be a debilitating disorder that requires treatment, often with professional help and sometimes additionally with medication. The disorder often presents with other mental health issues, and can lead to the following: low self-esteem and negative self-talk, trouble being assertive, poor social skills, isolation and difficult social relationships, hypersensitivity to criticism, low academic achievement, Drug and alcohol use in older children. Suicide or suicide attempts. 6. Differentiate social anxiety from other disorders. A mental health professional will ask lots of questions to try to determine if the problem is social anxiety disorder or a different mental health disorder. There are many symptoms that are common in social anxiety disorder that also exist in other anxiety disorders, as well as other mental health disorders and even medical problems. Share as much information as you can with the mental health practitioner to help them make an accurate diagnosis. You can also learn more about what distinguishes social anxiety from other disorders to best know how to help your child. General anxiety disorder has many of the same symptoms as social anxiety, but occurs unprovoked and regularly, not just in conjunction with social or performance situations. Remember, however, that social fear can come well before the anxiety-provoking event. In panic disorder, the child experiences more than one unexplained panic or anxiety attack, and also experiences anxiety at the idea of having another panic attack. Fear of being in a large group or environment that feels difficult to escape indicates agoraphobia. Separation anxiety shows up as extreme fear of being away from parental or caretaking figures. Extreme clinging of social anxiety can look a lot like separation anxiety. Fear of perceived physical flaws being overly criticized in public can be a symptom of body dysmorphic disorder. Social and/or speech delays and repetitive behavior could be signs of autism. Refusal to speak or be social, tantrums, lashing out, and rule breaking may indicate oppositional, defiant disorder. This is caused by a desire to defy rather than a fear of the event. 7. Talk to your child's pediatrician or to a mental health specialist. Social anxiety is a treatable condition. A professional can assess the severity of the anxiety, prescribe treatment if needed, and give you tips on how to help your child cope with anxiety. A form of therapy called cognitive behavioral therapy is shown to be helpful for many children with social anxiety disorder. Warnings. If you worry that your child is becoming suicidal, seek help immediately. Take your child to their doctor or call 911 or emergency services in your country if your child is in immediate danger. You can also call the National Suicide Prevention Hotline if you need support, 1-800-273-8255.